Good morning, everyone, and thank you for joining us today. As Abraham said, you are joining Transform Your Community, Best Practices in Health, and this is a webinar sponsored by Public Health, Law, and Policy. Before we dive in, I just want to make a note about technical support. If you have any technical problems, you can send a message through the Q&A box to WebEx Assist. You'll see that listed at the top right-hand corner of your screen, and they can help you with any issues you're having with viewing the webinar. And then if you're having any trouble with the audio portion, dial *0, and the WebEx operator will assist you with that. So I'm Christine Fry. I'm Policy and Program Associate here at Public Health, Law, and Policy, and I'll be the moderator for this webinar. For nearly 15 years, PHLP has helped communities create laws and policies that make the healthy choice the easy choice. PHLP's staff of attorneys, city planners, and policy analysts consult one-on-one with advocates and policymakers on tough legal and policy challenges, develop practical tools and solutions, and train local leaders to use our model laws and other resources in their communities. Joining me today is Manel Capagoda, the Deputy Director of PHLP's Childhood Obesity Prevention Program. Prior to Public Health, Law, and Policy, Manel worked in legal aid services and has done extensive work in advocacy and on behalf of those living with HIV/AIDS.
Hi, everyone. The recently announced Community Transformation Grants provide a great opportunity for communities to make real impact on chronic health problems. But the money is going to go to communities that have put together specific plans that will lead to measurable improvements in health, and that make those improvements by changing the community's underlying infrastructure. On this webinar, we're going to share lots of examples of how communities have identified policies with the greatest impact for change.
Thanks, Manel. We're also joined by Dr. Robert Ogilvie, Director of our Healthy Planning Program. Robert has extensive experience working in community development and city and regional planning.
Good morning, everyone. Each of your communities is probably starting at a very different place. Some of you are trying to build the capacity to make changes, while others already know what needs to be done and are ready for the tools to make a difference. On this webinar today, we are going to share some examples of how PHLP has worked with communities at all stages of the policy development process to show you how these interventions have made a difference.
Thanks, Robert. Finally, one more person I'd like to introduce you to. We're joined by Leslie Zellers, who has spent most of her career involved in legal and policy work in tobacco control, and who has worked in the health department in Contra Costa County, California. She directs PHLP's tobacco control program.
Good morning, everyone. We're happy to be here, and we're going to be covering a lot of ground today. So if you have any questions along the way, we encourage you to use the chat box, which you'll see on the right-hand side of your screen. If you submit a question to all of the panelists, we will do our best to answer the question at the end of the webinar. If we happen to run out of time and don't get to all of the questions, we'll post a list of questions and answers on the PHLP website by early next week.
Developing, implementing, and enforcing policy is an ongoing process. At PHLP, we've identified 5 major phases of the policy process, which you'll see up on your screen. First, a community assesses what opportunities there are for policy change. Then, the community develops strategies to address those opportunities. Those strategies give rise to the right tools to make the change, and then the community can implement those tools where they'll do the most good. Finally, it's important to figure out how to sustain the progress each community has made. Each of your communities is probably starting at a different place in the policy process. Some of you might be building the capacity to make needed changes, while others know what needs to be fixed, but haven't been able to develop the tools to make a difference. PHLP team members can help you achieve whatever your goals are. We're here to help you make practical, systemic change in your community. Now we're going to share some examples of how PHLP has worked with communities at all stages of this policy process. So first, assessing opportunities. What policies will do the most to help all residents of your community? When faced with multiple problems that need to be solved, how do you know where to start? Figuring out where the opportunities for change are is the first step toward helping your residents make the healthy choice the easy choice. You may have questions about which policies have the greatest potential to transform your community. The good news is that the local health department in your community often has access to vast quantities of data that can help you identify which policies have the most potential to reduce rates of chronic disease. The challenge is sifting through all of this data and translating it into policy. We often say that we're translators, helping health advocates speak the language of policy. One fantastic tool for translating health data into policy outcomes are health impact assessments. Robert, can you talk about some of our health impact assessment work?
Absolutely. When public health practitioners and academics at Johns Hopkins University heard about Transform Baltimore, a comprehensive zoning code update that would set the stage for development in the city going forward, they knew this policy would have a major influence on the health of Baltimore's residents for years to come. Using funding from the Robert Wood Johnson Foundation, a team of researchers conducted a health impact assessment of the proposed zoning code, with particular attention being paid to access to healthy food, opportunities for physical activity, and crime reduction through environmental design and through reducing the number of alcohol outlets. While the Johns Hopkins team identified the critical relationship between the zoning code and improving the public's health, they weren't zoning experts, so they turned to us. PHLP helped translate their health goals into specific zoning code language, building on examples from other communities, for allowing and promoting community gardens, farmers markets, healthy retail, pedestrian amenities, and for limiting fast food and alcohol. The final report presents a series of concrete recommendations to planners and to decision makers.
Thanks, Robert. And in case you're just joining us, if you have any questions as we go through this presentation, please do use the Q&A box in the bottom right-hand corner, and we will have some time at the end to answer any questions you might have. So once you've just identified where the real needs are, it's time to sort through the policy options and decide what approach will be most effective. PHLP often helps communities figure out what strategies will work best for them. We have a wealth of experience with communities of all sizes and develop creative solutions that fit the needs of those communities. Leslie, could you share a little bit about how we worked with tobacco control advocates in Nevada to find the right solutions to fit their needs?
Sure, I'd be happy to, Christine. PHLP was asked to provide a wellness policy summit in Carson City, Nevada, and the summit brought together community leaders from 8 neighboring counties and 7 Indian tribes. And at the summit, we provided information on the most effective strategies to reduce tobacco use, one of which is increasing tobacco taxes. You can see here the price of cigarettes. This is probably a state that doesn't have an extremely high tobacco tax. And another major strategy is creating smoke-free areas. As part of the summit, we worked with participants in small groups to determine which policy options were right for their community. For example, one of the groups looked at creating smoke-free parks in their county. And as part of this process, they evaluated what's the political will in their community to create smoke-free parks. Who are some of the potential allies and supporters of this kind of policy campaign? Additionally, they also looked at who would potential opponents be in order to be prepared to counter the arguments of opponents. Another group laid out a long-term strategy to strengthen the state's smoke-free air law. It's called the Nevada Clean Indoor Air Act. And ultimately, their goal is to broaden the law so that it's clean air and not just clean indoor air, to prohibit smoking in places like outside doorways, on sidewalks, and in other public places outdoors. However, based on the political reality in Nevada, the group also looked at a short-term goal of protecting the Nevada Clean Indoor Air Act from being weakened by the state legislature, which is a real concern in Nevada right now. At the end of the summit, each participant left with a framework for how to assess the right policy solution for their particular problem, and they also left with a strategy for moving forward on that policy option once they return to their community.
Thanks, Leslie. Once you've figured out the right approach, it's time to put together the tools your community needs to get the job done. Our organization, Public Health Law and Policy, has a number of tools ready to go that can help communities achieve their goals. But we also are great at developing new, highly effective tools that are legally sound and relevant to the problems your community is facing. Sometimes those tools include a model policy, ordinance, or resolution. Manel, can you talk about how PHLP helped a community in Mississippi open up their school recreational facilities for other residents of the town?
Absolutely, Christine. Although Mississippi ranks as the most obese state in the nation, it is home to some really inspiring local leaders who are using policy tools to improve the health of their communities. One such leader, who many of you may be familiar with, is Chip Johnson, the mayor of Hernando, which is a small town in northeast Mississippi. Mayor Johnson has put a number of healthy living initiatives in place, including replacing sidewalks, starting a farmer's market, and using joint or shared use agreements to open up schoolyards to create safe places for children to play. As he noted at the press conference kicking off the First Lady's Let's Move campaign, he used Public Health Law and Policy's many joint use agreement tools to formalize agreements between Hernando's schools and the city. Our tools include 4 model joint use agreements, a joint use checklist, an analysis of state law for every state, and a fact sheet explaining basic concepts related to joint use agreements for those folks that are just starting off in this area. We have developed these kinds of practical, in-depth tools as part of our technical assistance offerings to enable highly effective local policymakers like Mayor Johnson to achieve their goals quickly and efficiently.
So once your community has the tools ready to make change, it's time to take action. That means putting the policy tools in place and then enforcing them. And, of course, the action your community takes must be evidence-based. Leslie, can you talk about how PHLP has helped communities in California accomplish this in the area of smoke-free housing?
Absolutely. I'd be happy to. So Public Health Law and Policy worked closely with the city of Belmont, California, to create what became the first smoke-free housing law in the country. Belmont is a city south of San Francisco of about 25,000 people. And Belmont first became interested in smoke-free housing after a group of senior citizens living in a local retirement complex had been hit by a fire started by a tenant smoking. So the residents came to the city council and they showed up with their walkers and their wheelchairs and their oxygen tanks, and they asked the city council to find a way to protect them from secondhand smoke drifting into their units. And the city council of Belmont was very moved by their plea, and they wanted to protect these residents, and they also wanted to ensure that whatever protections they provided to these particular senior citizens, those same protections were afforded to everyone in the city of Belmont. So PHLP worked closely with both advocates and the city attorney in the community to help craft a law that met the city's goals. So after about a year of debate in 2007, Belmont became the first city to prohibit smoking in almost all multi-unit housing units. So their law applies to apartments or condominiums that share a floor or ceiling with another unit. As you can see from this photo, smoke will drift, particularly if someone is standing outside their window. As we see in this photo, it can drift to the unit above or below. Smoke also drifts through walls or ventilation systems and can affect people in neighboring units. So what Belmont did is they put a 14-month grace period in the law that allowed apartment buildings time to comply with the new rules, to do education, to make sure everyone was informed. So in early 2009, the law finally took effect, and we're pleased to report that since the law has been implemented, the city hasn't had to issue any citations for smoking. Since Belmont paved the way to become the nation's first smoke-free housing law, PHLP has worked with more than a dozen other communities in California to create their own smoke-free housing laws. So this is definitely a strategy that is becoming much more doable.
Thanks, Leslie. So in case you joined late, I just want to remind you that you can use our Q&A box, which is in the bottom right-hand corner of your screen, to ask any burning questions you might have about what PHLP can do with your organization or agency, what resources we have available around tobacco control policy and obesity prevention. So don't be shy. We'll get to those at the end of the session. So on to our final step here. Once you've taken action on your vision of a healthier community, how do you know it's been successful? What steps can you take to sustain that success and make further improvements? PHLP can... Go ahead, Robert.
Sorry, Christine. I didn't mean to cut you off. I think it's critical to add in here that PHLP can assist at any stage of the policy development process. We can add value wherever your community wants to bring us in. And one area where we've made a great deal of difference in terms of sustaining progress that has already been made is in figuring out who needs to be at the table, who needs to be talking to each other, and in facilitating those conversations. This is especially important in the case of groups that might not, at first glance, seem like they have a natural fit and a natural role in building and sustaining healthy communities. For example, public health departments generally do not talk to redevelopment or urban renewal agencies. But when the two groups work together, they can make very positive changes to the built environment of a low-income community. Redevelopment or urban renewal agencies are in place in most, if not all, urban settings across the nation. These agencies can fund infrastructure in underserved communities. Infrastructure can include parks, bike lanes, safe routes to school, street lights, much more. These funds for infrastructure can be harnessed to promote public health goals, and this is beginning to happen in communities all across the nation. One example that I really want to highlight is in Los Angeles, where the Community Redevelopment Agency, as they call it there, is partnering with the Public Health Department and with community groups to transform several corner stores in South LA. The health advocates are doing what they do best. They engage youth, they conduct in-store taste tests, and they're doing community outreach. They've made sure that the stores are being set up to accept WIC and SNAP so that low-income people can take advantage of the new healthy choices. And the Community Redevelopment Agency is doing what it does best, funding in-store renovations like refrigeration that will allow store owners to expand their offerings of healthy food choices. Now, the research on this is very clear that strategies to increase access and affordability of fresh food have the potential to reduce obesity rates and rates of chronic disease. But in places like South LA, achieving these goals and sustaining progress for the long term requires bringing partners to the table who are uniquely positioned to develop creative, sustainable solutions to the problems at hand. Strengthening the process through these new partners can increase access to funds and can boost your community's capacity to sustain change over time. PHLP has proven experience working to bring groups together, and it makes a big difference in the success of systemic policy change. PHLP works with communities to build relationships between public health and redevelopment agencies so that the funding is available to promote and sustain public health goals. We've brought together a range of leaders from across California, including mayors, city and county redevelopment agency directors, state government staff, and others to explore the key tools that redevelopment agencies have available that can be harnessed to fund public health goals. These sorts of meetings foster coalitions, develop working relationships, lead to joint planning, and most importantly, lead to the joint action that can sustain improvements in public health.
Thanks, Robert. I think it's important to say again that there are many steps to developing healthy policies that will change your communities from the ground up. And though we've presented these in a certain order and broken down in a certain way, the work can start at any point in the process. No matter where you are, PHLP has tools and resources available and can help support your work with our technical expertise. So now we're going to take some questions we've gotten in the Q&A box, but you can keep submitting them, and we can answer those as we go. So make sure to enter those in the Q&A box in the right-hand corner. And if there are any questions that we don't answer on the air, we will definitely put answers up on our website. So the first question, just to sort of recap for folks who may have joined and missed the first intro of PHLP, Leslie, can you talk a little bit about what PHLP does in general and is currently doing with the Communities Putting Prevention to Work grant?
Sure, Christine. So Public Health Law and Policy is a nonprofit organization. We've been around for about 15 years. And we have really deep expertise helping communities in the areas of tobacco control and childhood obesity prevention. On the tobacco control side, we provide technical assistance to communities in California, and we've done so for 15 years. And we're also part of the Tobacco Control Legal Consortium, which is a network of tobacco control legal centers across the country. On the obesity prevention side, we're funded by the Robert Wood Johnson Foundation through, some of you may be familiar with the acronym NPLAN, the National Policy and Legal Analysis Network to Protect Childhood Obesity. So we provide technical assistance to communities on childhood obesity prevention to help them create healthier environments and more opportunities for physical activity and healthier food choices through that funding. We also are the national technical assistance provider to current CPPW communities. So that's a program, the precursor to the Community Transformation Grant Program. Through the Centers for Disease Control, they've funded 50 communities across the country with a range of policy strategies to prevent childhood obesity and to reduce tobacco control. So we work directly with communities to help them achieve their policy goals in the area of the built environment, creating healthier communities, reducing access to unhealthy food products, and, as we said earlier, making the healthy choice the easy choice. We're a multidisciplinary team. We have attorneys, urban planners, public policy specialists, so we really have a range of strategies. And as was mentioned in the chat box, all of the tools that we're talking about are available on our website, and we'd be happy to talk with you one-on-one to pair up the right tool for the particular policy that you're looking for.
Leslie, if I just may add, this is Robert here. If your community is not one of the aforementioned CPPW or NPLAN grantees or part of one of the other programs that Leslie mentioned, we are happy to work with you on a fee-for-service basis. We've been doing that for many years in many places across the country. So if you have a goal or some policies in mind to improve health access, healthy places, food availability in your community, feel free to reach out to us, and we'll see how we can work together.
Thanks. We also got a question about whether this PowerPoint was going to be posted online, and it will be. And that's our website is phlpnet.org, and we'll get that in the chat box as well. So please do share that with others in your agency or organization who might be interested. So we got a question about the policy process, and someone noted that we put the evidence-based part in the implementation portion where we're actually writing the law, but they wondered if evidence-based research should happen before that. So, Manel, could you comment a little bit on that? Or maybe Leslie, could you jump in?
Sure. Yeah, the example we gave for implementation was a smoke-free housing policy, but you're absolutely right that the community would have done some strategy selection earlier than that. so I think that the stories that we're telling here, just for purposes of clarity, include many different steps. So we were highlighting the implementation in terms of smoke-free housing in the form of a law, but you're absolutely right. You would back that up and see what is the problem in your community. Do you already have, just using the tobacco example, do you already have smoke-free workplaces? Do you have smoke-free indoor workplaces, including bars? Do you have smoke-free outdoor workplaces? I think the CDC is giving strong preference to those kinds of policies before you move on to something like smoke-free housing. So you definitely would want to assess what the existing laws are in your community, what the political will is, what communities are most interested in order to decide what strategies you want to move forward on.
Thanks. Robert, a question for you about the Baltimore example. Is PHLP still working with the City of Baltimore? And can you talk a little bit about how that process has gone and who the partners are?
Yeah, that was a specific fee-for-service relationship I mentioned earlier that we enter into them. So we're not still working with the City of Baltimore. We came in to help comment on the health impact assessment process. And we've not been engaged since then. They didn't need us. They've got a lot of experts there. So if you would like to know more about it, I can, reach back to the people who we worked with and find out what's going on in that process and communicate that to you.
Let's see what else. We've got a lot of questions here. So one question, and anybody is free to answer this, how do you get your community involved if you're not already working with health advocates within the community? Any suggestions for building those relationships?
I'll start off and then let others jump in. PHLP typically follows what we call a train-the-trainer model. We're not community organizers ourselves. We come in and work with health advocates and others who have begun some sort of community process to determine what's necessary in a community and what sort of change is needed. And if that hasn't already happened, what I see as a good way to start is to reach out to the public health department, to reach out potentially to some of the public health nurses, to reach out to the healthy food advocates and the safe routes to school advocates who exist pretty much in every community, and start to work with them. That's a good way to get that community process started in places. And that community process is really critical for creating the demand for healthy places, and that demand can help drive public policy.
Thanks, Robert. There's a question here, and I'll send this to you, Leslie, about smoke-free policies in housing. It sounds like there's a community who wants to implement a smoke-free policy for a housing authority apartment building where the residents have physical and mental disabilities. Do you have any suggestions for how to approach the development of that policy and particularly the compliance portion of it?
Yeah, it's a great question, and it's a very practical question. The person who asked the question said they're considering offering cessation services, which is definitely a great start because the more you can encourage those residents to quit smoking, the fewer problems you'll have with compliance. I think that what some communities have done as a concession in these areas is they have included a grandfather clause in some of these units if it really is unrealistic for some of these residents to quit smoking. I think that most of the communities that have worked on policies, particularly in housing authorities, and there's a group in Michigan that's done a lot of work on this, they'll start with a survey of tenants to see how many people are supportive of such a policy and how many people are opposed, because often you hear from the opponents and it may give you a distorted sense of how much opposition there is. So finding out how many residents you're talking about who are smokers who may have physical or mental disabilities gives you a much better better sense of what the scope of the challenge is. And it's sometimes possible to group smokers in one part of the physical complex. It depends what the building looks like. If it's all one building or if it's separate buildings, you might be able to group some smokers together so that the effect of drifting smoke on others is limited. And then I think in terms of compliance, including some sort of phase-in period with cessation is definitely a great strategy. And I'm happy to talk to you more offline if you want to talk about this further.
Thanks. Okay, so we're going to take one more question before we wrap up. And this one is, I'll send it to you first, Leslie, but it sort of combines our tobacco control work with our land use development work, Robert. So maybe you can follow up on this. So this person is interested in convening a summit, bringing together land developers and property management firms to discuss tobacco-free multi-unit housing. So, Leslie, can you talk a little bit about how developers have reacted to those proposals in the past?
Yeah, it's a great question. We have definitely participated in some of those kinds of summits. And again, it's a really interesting discussion because often developers and property managers are resistant to creating smoke-free policies because they don't know enough about it. They're worried about legal issues. They're worried that perhaps it's not legal to prohibit smoking. And so once we provide them with the information that it is absolutely legal to create a smoke-free policy, it puts a lot of their fears at rest. And we also talk to them about the potential legal risk for other tenants who have asthma or COPD who are being exposed to secondhand smoke, that they may have potential liability issues with that. And often developers and other property managers are receptive to an issue if they know that it's going to be a level playing field. They won't necessarily come out and be on-the-record supporters of a policy to create smoke-free housing, but often they'll be neutral because if there's a law in place, then it means that everyone is playing by the same rules. And there are often, you can bring in existing property managers or owners who have voluntarily implemented a smoke-free housing policy in their particular complex and talk about how successful it's been in terms of tenant satisfaction, lower cleaning costs, lower fire risk, decreased maintenance, decreased turnover costs. So there are a lot of good strategies to get the property managers and developers on board.
And Robert, can you comment just a little bit about our work getting developers involved in public health initiatives in general?
Sure, Christine. Yeah, I don't have anything to add about tobacco, but we have been reaching out to developers and starting to work with them, largely through our redevelopment contacts. And what we're finding is that there's a significant and growing group of developers who are looking to build healthy communities because they understand that gives them a competitive advantage over others. And we're talking to the Urban Land Institute about partnerships to develop more trainings for developers so that they can understand what is involved in building healthy communities. As Chip Johnson, the mayor of Hernando, who Monel cited earlier on, has noted, his town, which is a suburb of Nashville, has prospered and kept its property values high because people understand that it's a good and healthy place to live. And that's becoming more attractive to developers. So we're starting to talk with them to develop sort of a roster of healthy developers who we can help connect to cities that are looking to develop in a healthy way.
Thanks, Robert. So I want to thank everybody for joining us today and for submitting all of your great questions. We had more than we could get to during the time that we had planned. But if you want more information about what public health law and policy can do for your organization or agency or community, or if you have more specific policy questions, like some of the ones we answered on today's webinar, please contact us via our website, which is phlpnet.org. It's up there on your screen. Again, it's phlpnet.org. And finally, we wish you the best of luck with your CTG applications. Thank you.
All right, thank you very much. Well, again, ladies and gentlemen, that does conclude today's call.